Earlier this year, I announced changes to how we pay for overhead when physicians work in hospitals. Our intent was to ensure that physicians were paid for the costs of running their offices when they work in them, not in hospitals where taxpayers already pay for the overhead costs. Now, I've heard from my colleagues, from rural physicians, as well as from rural leaders all across the province, that this policy forces physicians and hospitals to make choices which reduce access, and this was never our intention. Many rural physicians organize their business model around practicing in hospitals and clinics. And rural hospitals, especially their emergency departments, work differently than in cities. They depend on rural physicians for coverage, and we need to maintain that coverage in Alberta. Rural physicians will be exempted from the overhead policy that took effect on March 31st. The rates they charge for working in a hospital will remain at the same levels as they did in 2019-2020. Further, I'm pausing the implementation of the policy for urban physicians as well until AHS completes a review of this policy.